Good afternoon, everyone. I'm your hostess, Anne Marie, and I'd like to welcome you all to our program. We're all familiar with the current situation in Flint, Michigan, where thousands of people have been exposed to lead through contamination of water. And I know of at least 2 prominent medical professionals who have appeared on both talk radio and network television programs and have stated that there currently is no oral treatment for lead poisoning, which means you can't just take a pill to rid yourself of the toxin. This week I learned some startling new information. It actually is possible to orally treat for lead. And I've asked Gary Cools N.D., which means naturopathic doctor, by the way, to help me share this new information with you. Hi, Gary.
Hello.
Could you start by telling our viewers what a naturopathic doctor is and also giving them a brief explanation of the several hats you wear in alternative medicine?
Okay. Actually have a lot of training. A naturopathic doctor is a physician who does not use pharmaceuticals and doesn't use scalpels, doesn't perform surgeries, but generally most other mechanisms are available to them, and we're trained to read blood labs and look at the commentary on MRIs. And actually we do a very detailed patient intake, which is probably more thorough than most. And the other thing is we borrow outside of the United States, and we try to have a world view on the tools that are available to help people have health.
That's excellent. That's excellent. And some of the other fields that you've training in?
I have training in as a master herbalist, knowing the characteristics of about 3,000 herbs and their interactions with other things and contraindications. I'm also an acupuncturist, accepted by the Veterans Administration to provide services to our troops, and studies in physiology, biology, and basic biochemistry.
Excellent. That's excellent. Can you tell me then, is it really possible to rid the body of lead through oral treatment?
Yes, oral treatment is considered doable. It's measurable as a benefit. If it isn't as intense as is required by a patient, they will switch to intravenous. But oral chelation, oral remedies are available which do work. Their initials are EDTA and DMSA and DMPS, and each one has their own characteristics.
Could you explain briefly what chelation therapy is, and then also talk a little bit about each of the 3?
Yeah. Chelation is where a substance is bonded to something that you want to remove from the body and it won't let go. So typically something like EDTA will have 4 EDTA or 5 EDTA molecules bonded to a lead molecule, and they will not release. And in the filtration process, especially in the kidneys, it'll get tossed out as a complete thing with the lead and the EDTA still stuck to one another. Okay. And it's a means of getting rid of that. And actually with that mechanism, you're only cleaning up the blood.
Is one of the 3 preferred, or does it depend on the individual situation? Because I've heard a lot of good about DMSA.
I have a chart here by a professional, a naturopathic doctor like myself, and depending on the toxin, like arsenic or cadmium, take different things. Things like thallium or mercury take different things. But if you focus on lead, the leader is DMSA.
Okay.
It can be taken orally. It's regarded as more effective taken intravenously and monitored by an MD or a DO. And sometimes you're in intensive care in a hospital to get almost instant feedback on blood labs and other characteristics to keep the patient out of trouble.
Are these treatments used by both Western and naturopathic medicine?
Western medicine, yes. Naturopathic medicine, it depends on the state that you're in.
Okay.
In some states, a naturopathic doctor can use intravenous mechanisms. In Michigan, they can't.
Now, can people who are or who have been exposed to lead receive any kind of testing? I mean, if you're, say, a Flint resident, do you partake in this chelation therapy or take it, either orally or intravenously? without being tested to make sure that you actually have the poisoning, or do you just assume that because you were exposed that you do?
Chelating for lead for anybody is not entirely a waste of time.
Okay.
So the weaker oral chelation might do some good for virtually anyone.
Okay.
In terms of bone condition, heart and brain condition.
Is that hard to come by? Are there certain places that do that? If somebody's watching this and has been exposed and is interested, is there a place they can call where they can find out in their area where they could get this test?
It takes a number of phone calls to find out what is available.
Okay.
I see that happening most often in clinical conditions and not in a family physician's office. And the other thing is it would be a good idea to have trained professionals taking a look at all of the factors and keeping records.
So if we could get, say, the Flint Health Department or such on board with this idea, it'd make it a lot easier because, I mean, if you think of the people you know, they're scared. Maybe they don't have the kind of medical savvy that obviously that you would.
Thank you.
And they don't know where to step. And if you call a doctor who is not familiar with this and they debunk it, then you're going to kind of be dead in the water. So it's really, in my opinion, important to get the powers that be on board.
What makes it easier is the Center for Disease Control, which is part of the federal government in Washington, D.C., they have already charted out how much DMSA to give to a person who's living in Flint, for instance, and they're known to have drunk the water.
Okay.
According to body weight and age and height.
Now, if a family is interested in using this, if either an individual or somebody wants to give it to their kids, I mean, they think their kids have been exposed, and let's say they can't get the test, do they have to do the treatment under a doctor's care, or can they get it themselves?
I would put some warnings out for trying it on your own.
Okay.
Number one, you don't know how badly you're poisoned, and you don't have a chart to go by for doses.
Okay.
And in most cases, a person would use the oral type, probably EDTA, because the DMSA is very expensive. They would use the EDTA, which is more affordable. And EDTA takes out more than lead.
Okay.
It takes out some rather essential metals along with it. So it'll take cadmium, which is bad, and arsenic and mercury to an extent, which are all bad. However, it'll take out calcium, some magnesium, zinc, and copper, and those are essential metals.
So you have to replenish those.
So you would have to take a multiple mineral supplement about 2 hours later to keep yourself out of trouble. And in the meantime, you wouldn't know how far your levels dropped. So without supervision, that gets risky.
Yeah, so if you don't have a working knowledge, don't touch that.
I wouldn't recommend it. Light chelation on an individual basis, self-directed, probably won't hurt anybody. If you have hypercalcemia or some other problem that is mineral related, don't do it. People should be cautious and probably not dive into it.
Would certain groups be excluded from chelation therapy as treatment for lead poisoning, such as seniors, infants, children, pregnant women?
Mostly the pregnant women.
Okay.
Their bloodstreams and the baby's bloodstream, their retention of lead in the mother's bones, etc., are different at different trimesters of the baby's growth. And if you start to chelate that system, which is 2 people, you can damage the baby.
Oh, ouch.
So you don't want to bother with that.
No.
The way out is to get them lead-free water immediately.
Okay.
Get them in a lead-free environment, which is, if the house has lead paint, get them out of that.
Okay.
Make sure nobody's sanding the paint and changing it in any way. Remove them from that environment.
Okay.
And to give them a good vitamin, especially a complex vitamin C, and maintain a relatively high level of health. And then once she's done giving birth to the baby, they can be treated separately.
Okay. Now, what are the chances of a pregnant mother, giving her baby lead poisoning, and how soon can the baby be treated? Can they treat infants, or do they have to wait till they're older? They
have to wait a while, and that's up to the MDs when they can go through a chelation process, depending on the health of the baby. If it's uncompromised, they can have the chelation earlier. If they have compromised health in some way, they would have to wait. And to choose words carefully, the mother doesn't give lead poisoning to the baby. They get lead poisoning together when she gets a drink.
Okay.
So it's just shared.
It's shared.
Yeah.
Okay. Okay. And am I right in saying that it is not like lead is not like other toxins such as like dioxin where it stays in the system for generations to come?
No, it's not transferred to infants. If the mother only was contaminated and she gets pregnant, she's not going to necessarily give it to her baby.
Got it. Okay.
Maybe in small amounts because her blood will be a little bit contaminated.
So it's not
But the majority of the lead will be in kidney tissue, bones, and the brain.
So then it doesn't transfer to the third generation.
It generally gets invested in the tissue and stays.
Okay.
Yeah.
Other question that I have, I'm just curious about this. Can they get rid of the lead without doing significant damage? Because I understand that it does stay in the fatty tissues. How does that work?
I don't think it does much damage to get it out. The question is, can you provoke the cells to give up the lead inside the cell membrane? Chelation takes care of the bloodstream. So some careful investigation shows that if you use alpha lipoic acid, maybe 5 weeks into chelation, because you don't want to start messing with the nervous system initially. If you use alpha lipoic acid, you can provoke the cells to give up some of the lead inside the cell membrane, especially brain cells.
So alpha lipoic acid is in pill form, correct? And doesn't it
Generally available.
It breaks the blood-brain barrier?
It opens it up.
Okay.
And it helps invite the cells to give up garbage that's inside. A second supplement, which is over the counter, is called N-acetylcysteine.
Oh, yeah.
And they abbreviated that NAC, so you see on the bottle it might just say NAC. And that will go inside the cell, and the cell will use it to make glutathione, which is your body's own chelator.
Okay.
So if you have an abundance of NAC, it's easier to make a chelator inside the cell to throw out the trash.
Without even having to use the others?
You still have to clean up the blood.
Okay, got it. So that's afterward.
Yes.
Okay. What about those with compromised immune systems? How do they work with them? If they do chelate them, it has to be intravenous, or how does that work?
Either way still.
Really?
And the thing is, they generally build immune system as soon as they start getting rid of the lead.
Okay.
So it's not so challenging, it's restorative.
Okay. How long does this treatment actually take? I mean, how long does it take? I mean, I know it's probably dependent on the severity of each case, right?
One session takes 2 to 4 hours,
Okay.
depending on how the doctor sees the vitality of the patient.
And that's the intravenous, correct?
That's the intravenous
Okay.
type. And usually they will go up to 5 to 7 days in a row.
Oh, wow.
And then they will give them a vacation, and that's up to the doctor, but it's usually 7 days to 2 weeks.
Okay.
And then they'll do it again.
Okay.
And the actual length of time that they do this cycle, which would be roughly, 21 days, they might do it for 6 months, depending on if they worked in a factory producing lead acid batteries or some other application like that where they were heavily contaminated.
Okay. Now, what about the oral? How long does the person have to take the pills?
It's less intense, and
Okay.
it would have to be taken longer if somebody's going to try and do that on their own.
Okay.
It's not as effective in removing it.
But a doctor could prescribe it as well, the
Yeah.
oral method, right?
Yeah.
If they didn't feel it was as severe.
Both methods will pull not only lead but some other things out of your body. The DMSA pulls, I believe, some calcium out of your body extra. The thing is, when you bring that into the blood and change the composure of the blood, sometimes you end up having diarrhea and
That was actually
other
my
issues.
next question.
and sometimes it becomes so difficult that the patient can't bear it, and you have to
back off.
have to change the pattern.
Yeah, that was actually my next question. Are there any other side effects?
Even if you take the weaker oral EDTA, you can end up having diarrhea and not being able to leave the house.
Oh, wow.
So those things have to be adjusted.
Okay. So basically then, there are other options. It's just a matter of getting people to recognize them. And maybe people have, maybe they have a basic knowledge, but haven't worked with it themselves. And so getting the information to people who can actually do something about this is the best bet, because the citizens can't act without somewhere to go.
They really need outside diagnostics. to find out how heavily contaminated they are. And they also need outside diagnostics to let them understand how they're responding to the chelation. If their body responds in an aggressive, purging manner, they may be very violently sick and not understand what's happening.
So if doctors don't use any form of chelation, what do they do? Do they just let them go? Is there something else they try?
The importance of removing lead from a human being's environment has never been overestimated.
Okay.
It's probably as important or maybe more important than the chelation.
Okay.
So they get lead-free water, lead-free air, a lead-free environment to live in, and basic one-a-day vitamin and some complex vitamin C, not simple vitamin C, and they will, to an extent, begin to recover.
Okay. So somebody who is mildly affected could potentially get by without doing either of the therapies?
They will probably end up being damaged in some way.
Okay.
Lead goes into the bones and makes them more porous and more osteoporotic. It tends to damage kidneys.
Wow.
So you have renal damage, and it gets invested in neurological tissue and brain tissue, so you can see IQ drop and those kind of capacities drop. If the tissue goes through a dramatic change, those changes might be irreversible.
Oh, wow. And how long does it take for this to happen? Does it happen in a short amount of time, or are these not observed for years to come? How does that work?
In some children, they get encephalopathy rather quickly.
Okay.
And some of them have seizures, easily observable, and so you know they're in trouble immediately. Other people have numb extremities if they're pretty heavily poisoned, but in a lot of cases they're significantly poisoned and they don't see any change, up to 4 years.
So if you have a child, for instance, let's say 4 or 5, and when they're poisoned, and then they're put in a lead-free environment, they could actually be 9, 10 years old before they see any damage if they're not treated.
Yeah, like inability to keep up with their peers in school.
And by that point, is it then too late to rid the body?
Probably.
Wow. That's frightening.
Yes, it is.
That is very frightening. So, in closing, is there anything that we can offer people, or any resources, should I say, any places they can call?
In addition to taking a look at resources for the CDC, which are really easy to examine on the internet, Mayo Clinic has some good resources, and there's a facility called the American College for the Advancement of Medicine, which is unusually deeply trained to deal with environmental toxic issues, like an entire city having a chemical spill or something of that type.
Okay. Well, Gary, we've given our viewers a lot to digest. Could we do a quick review for them, exactly what to do or where to start?
Yeah, I would want to say that as a person who knows that they've drunk Flint water that was contaminated, they will take care of you with DMSA, most likely, intravenously, if you're pretty well contaminated, or some other choice that makes sense based on the work that the CDC has put together. But as an individual, they can add alpha-lipoic acid about the 4th or 5th week, after they've already cleaned up the warehouse to an extent.
Okay.
They can add N-acetylcysteine, same time, 4th or 5th week, to provoke getting contaminants out of the inside of the cells, past the cell membrane. And they can use something special called sorbus domestica to make the balloon around the brain, the blood-brain barrier, make the holes in it larger.
Oh, wow.
So that the EDTA, etc., can get in there and harvest some contaminants and get them out.
This can all be purchased online, correct?
Yes, it can.
Okay.
The only extra note of caution I want to add is sorbus domestica is supposed to be taken only as you go to sleep at the end of a day.
Okay.
You take your one-a-day vitamin and some NAC or EDTA, all good ideas, and the sorbus domestica, and you go to sleep, and that way you're not out drinking water with a lot of iron in it at some restaurant and getting into trouble.
Okay.
Some of the work that I was talking about has been very carefully researched in Belgium and Germany and France. The sorbus domestica is one of those, and it's been worked with for 40 years. It's known to be safe.
Okay.
Yeah.
And on the screen, we're going to be putting up some important resources for all of you, in case you want to call and get more information. And Gary, I'd like to thank you once again. This has
thank
been
you very
very
much.
informative. And thank you all for joining us.